gender-affirming care.
And that affirming an individual's identity without question is the only acceptable response. This approach abandons the core values of scientific and philosophical inquiry, namely skepticism, complexity, and the pursuit of truth. Ideology, in its most dangerous form, does not simply offer a perspective, it demands conformity. It rewards blind affirmation and punishes doubt. This is precisely what is happening in the current discourse around gender. Questioning the long-term efficacy of hormone treatments for minors, expressing concern about RAPA, Downset gender dysphoria, or pointing out the inconsistencies in the theory itself is often enough to be labeled a bigot or a reactionary. Such accusations are not arguments, they are tools of ideological enforcement. What makes this ideology particularly insidious is its appeal to compassion. It cloaks itself in the language of kindness, tolerance, and care, while simultaneously silencing dissent and shaming critical voices. The result is a moral inversion where those who raise legitimate concerns about the well-being of children, about the erosion of biological categories, about the long-term psychological effects of transitioning, are cast as villains, while those promoting radical and irreversible interventions are seen as virtuous. This is not how a healthy society navigates complex issues. True compassion does not require abandoning truth. In fact, truth and compassion must go hand in hand. To deny biological reality in the name of affirmation is not a progressive act. It is a negligent one. To encourage children to make life-altering decisions based on an unstable or ideologically driven framework is not kindness. It is recklessness. When an ideology becomes dominant to the point that it can no longer be questioned, it stops being a belief system and becomes a form of tyranny. Gender theory, when removed from evidence and elevated to dogma, ceases to help individuals and begins to control them, and that is the hallmark of ideological possession, when an idea controls people more than it serves them. One of the most alarming consequences of modern gender ideology is the way it has led to irreversible medical interventions being performed on children and adolescents based on unstable, subjective identities. Under the banner of affirmation, young people are being fracked into life-altering treatments, puberty blockers, sex hormones, and even surgeries, often with minimal psychological evaluation and without addressing underlying mental health issues. This movement is framed as a compassionate response.
Yeah, they just, everyone who has low social skills, or you got the tomboy, they're like, they feel whatever, they're just kind of, autism, you're gay, you have a fetish already, all these things, all the, let's say you're goth, well, you're depressed in that. No, you're just trans, we'll fix that up.
Response to gender dysphoria, but in reality, it often bypasses the rigorous safeguards that should accompany any serious medical decision, especially one involving minors. Children and teenagers are, by nature, still developing. Their sense of self, emotional regulation, and understanding of long-term consequences are far from fully formed. It is well documented in developmental psychology that adolescents frequently experience phases of identity confusion, experimentation, and self-doubt. In previous generations, this was understood as a normal part of growing up, not a medical condition to be treated with irreversible procedures. Yet today, if a child expresses discomfort with their gender, the prevailing model often encourages immediate affirmation and intervention, rather than careful exploratory therapy. This is especially troubling given the emerging data on desistance, the phenomenon where many children who experience gender dysphoria eventually grow out of it, particularly if left untreated medically. Studies suggest that a significant portion of youth with dysphoric feelings reconcile with their biological sex by adulthood. However, Once medical interventions begin, especially hormonal treatments that cause permanent changes, the likelihood of reversal declines sharply. These treatments carry serious risks: infertility, bone density loss, cardiovascular complications, and psychological effects that are not yet fully understood. Moreover, many of these decisions are being made in environments where dissent is discouraged, and questioning the affirmation model is seen as transphobic or harmful. Parents who hesitate are sometimes threatened with legal action or accused of abuse. Therapists who wish to explore a patient's broader psychological context are increasingly pressured to affirm first and ask questions later. This is not responsible medicine.
Yeah, I think in California right now, if you don't affirm your kid right then and there, I think they can take them off of you now. I don't know if they passed. They were trying to pass a law. I don't know if they passed it actually. But I do know if you're in a court case between a divorce thing, a man and a woman, and you got kids, if you don't affirm, and one of the parents wants them to be affirmed, they're going to be affirmed. And if you don't do it, they'll take you to court and they'll take your kid off of you and give it to the parent that wants to affirm the kid.
It is ideology masquerading as care. When irreversible treatments are performed on the basis of subjective identity rather than a deep evidence-based understanding of the patient's condition, it ceases to be health care, it becomes experimentation. And the subjects of this experiment are some of the most vulnerable people in society, children who deserve protection, not ideology-driven medicalization. Speaking the truth in the face of ideological pressure has become an act of moral courage, particularly in the current cultural landscape surrounding gender. The prevailing narrative demands affirmation of subjective identity claims regardless of biological fact, long-term consequences, or conflicting evidence. To question this narrative, even with empathy and reason, is to risk social ostracism, professional consequences, or worse. Yet the refusal to speak truth is not a neutral act. It is a form of complicity that allows harmful ideas to gain power unchecked. The consequences of this silence are already becoming evident, particularly in the lives of those most affected by gender ideology: children, families, and detransitioners whose stories are often ignored or suppressed. Truth is not a matter of opinion. It is the foundation of meaningful dialogue, ethical decision-making, and societal stability. When institutions, professionals, and individuals abandon truth in favor of ideological conformity, they do so at great cost, not just to themselves, but to the culture as a whole. A society that punishes truth-telling, especially in the name of compassion, loses its ability to protect the vulnerable. And when truth becomes subjective, power, not reason, determines what can be said, believed, or questioned. The debate over gender identity is not just about language or inclusion. It is about reality itself. If we allow ideology to redefine the very structure of what it means to be male or female, and if we elevate identity over biology without challenge, we are not simply creating space for self-expression. We are dismantling the conceptual and moral frameworks that make rational discourse possible. We are creating a world where feelings override facts, where perception trumps evidence, and where disagreement is treated as violence. But speaking the truth does not require cruelty. It requires clarity. It means acknowledging biological reality while treating individuals with dignity. It means resisting coercion while extending compassion. It means standing firm in the knowledge that truth, no matter how uncomfortable, is ultimately what liberates us, not lies, not flattery, and not silence. The stakes are not abstract. They are deeply personal and painfully real. People are being harmed, often irreversibly, because too many are afraid to speak honestly. But silence is not safety. Silence is surrender. And if we are to preserve the integrity of science, ethics, and freedom itself, we must reclaim our voices and speak truth, no matter the cost.
Opportunity to address you. My name is Miriam Grossman. I am a board-certified child, adolescent, and adult psychiatrist, author, and senior fellow at Do No Harm. I have been taking care of patients for 45 years. I'm going to use my time to respond to Dr. McNamara. First, I'm struck by her use of the phrase, sex assigned at birth. Sex is not assigned at birth. Sex is established at conception, and it's recognized at birth, if not earlier. Dr. McNamara claims that her views are science-based, but to claim that sex is assigned at birth is without any scientific basis whatsoever. Its language misleads people, especially children, into thinking that male and female are arbitrary designations and can change. That is simply not true. Dr. McNamara claims that social and medical interventions are the only evidence-based treatment and that scientific evidence shows it is life-saving. Without it, she's warning us, kids will commit suicide. Well, a growing number of countries have effectively banned the care to which she's referring. And thank God there's been no wave of suicides or other mental health catastrophes. 3 years ago, Finland placed strict limitations on medical interventions for minors. Sweden did the same thing after a 14-year-old girl was found to have osteoporosis and spinal fractures from puberty blockers. An investigation concluded, quote, the risks of anti-puberty and hormone treatment for those under 18 currently outweigh the possible benefits. The UK conducted a review and called the evidence very low. They've also placed severe restrictions on the care that Dr. McNamara calls life-saving. Norway also analyzed the data and has made similar changes in policy. The National Academy of Medicine in France warned, quote, great medical caution must be taken in children and adolescents given the vulnerability of this population and the many undesirable, even serious complications the therapies cause. Doctors in New Zealand and Australia have published similar statements. Is Dr. McNamara suggesting that all these countries are rejecting evidence-based treatment and placing their kids at risk of suicide? Regarding that point of view, Finland's gender expert, Dr. Rita Kaltiela, said, quote, it's purposeful disinformation, the spreading of which is irresponsible. All 7 countries, and Florida too, of course, concluded that kids don't need their development interrupted, the girls don't need their periods stopped and their voices lowered, and the boys don't need to grow breasts. What they need is psychotherapy. I have other objections to Dr. McNamara's testimony. She insists that her position, only hers, represents standard medical care. What she doesn't want you to know is that there is no standard. There's a debate. There's a fierce debate. And on the side opposite her stand such prominent figures as Stephen Levine, Kenneth Zucker, Paul McHugh, and James Cantor, among others. These doctors are giants in the field. They have been treating transgender patients and gathering data and publishing papers about them, and I mean no disrespect here, but since before Dr. McNamara was born. The point is that those veteran clinicians and others who have wisdom and experience are ignored because they disagree with the current narrative. They're against medical interventions for the same reason those 7 countries are. There is no evidence of long-term benefit, but there is evidence of harm. I'll end by quoting Jamie Reed, the courageous whistleblower from the Children's Gender Clinic in St. Louis. I believe that hospital receives the medical education funding that we're discussing today. She said that doctors at that clinic said, we are building the plane while we are flying it. We are building the plane while we are flying it. That's how they described the treatment at their gender clinic. Our precious tax dollars should not support such a perilous experiment.